Good evening, everyone. So, if I could just make an announcement as you all settle down. So, if you would like to speak tonight, you're going to fill out these yellow cards. There's one major item on the agenda that you're all picking up, and that agenda item is item 3. If you want to speak under something that's specific on the agenda, I'm going to ask when you fill out your card to write in item 3. If you want to speak to something that is not being discussed tonight, but is under the purview of the Children's Family Seniors Committee, then you want to speak under public comment, which is item 2. So most of you either signed in with item 3 or you left it blank. If you left it blank, I'm assuming you meant to speak under item 3 because that's the major topic tonight. But if there's an exception to that, if you could raise your hand if you want to just speak under public comment, because you want to speak under public comment, then could you bring it up, just write public comment on it, Maria? And then is there anybody else who wanted to just speak under public comment? So you're not going to speak on item 3, you're speaking under something that's not on the agenda. Okay, just bring it forward with public comment under it and we'll call you up. So let me just talk a little bit about what we're going to be doing tonight. So we have a number of speakers, and if you look at the agenda, great. Yeah, item 2. Oh, thank you. If you look at the agenda, what you're going to see is that we have a number of areas that we're going to try to cover tonight. Each of the speakers who's giving a presentation tonight will get 5 minutes to speak. We're going to leave the timer on because we have so many people that we're going to try to hear from that I'm just going to ask people to end at their 5 minutes. If you are one of our public folks that are doing public testimony, we'll call you up in groups, and as your group is called up, we're going to ask you to introduce yourself and start right away. So if I can, what I'm going to start by doing is asking folks who are on the dais to introduce themselves. And if we could start at the corner, Rhonda, if you could just introduce yourself and the organization you're with.
Hi, my name is Rhonda McClinton Brown. I'm the Branch Director of Healthy Communities Branch in the Public Health Department. Happy to be here with you tonight.
Thank you.
Good evening. I'm Tony Tullies. I'm the Director of the Behavioral Health Services Department.
Good evening. My name is Paul Lorenz. I'm the Chief Executive Officer for Santa Clara Valley Medical Center, which now includes O'Connor Hospital and St. Louis Hospital.
Dave Cortese, member of the Board of Supervisors.
Cindy Chavez, member of the Board of Supervisors.
Good evening. Rob Coelho, Assistant County Counsel.
Bob Minicucci, Director, Social Services Agency.
Maribel Martinez, Director for the Office of LGBTQ Affairs on behalf of Deputy County Executive David Campos and the Division of Equity and Social Justice.
Under Sheriff Rick Sohn with the Santa Clara County Sheriff's Office, filling in for Sheriff Lori Smith.
Could you turn on your mic and do that one more time?
Scott Slade, Assistant District Attorney. Good evening.
David Hill, VTA. I don't have a mic.
Thank you.
David Hill, VTA.
Thank you. And I see Assemblymember Ash Kalra. We'll be inviting him up. Come on up. And so what we're going to do is we'll start with public comment, and this is for items that are not on the agenda but within the purview of the committee. Each of these speakers will receive 3 minutes, and we're going to invite up Evan Dowling to be followed by Maria Hernandez, and those are the only public comment speakers I have.
Me as well.
You were speaking under item 3 or public comment?
It's on the slip.
Evan Dowling, Management Analyst. Supervisor Chavez, I addressed you at last week's Orchard City Indivisible meeting in Campbell as follows. In 2014, as you are aware, James Ramoni demanded that I revise 104 public guardian policies and procedures within 5 weeks, an impossible task. In 2015, well after Mr. Ramoni expelled me from the public guardian's office, he promised you at your committee meeting that all policies and procedures would be revised by the end of year 2015. 4 years later, in 2019, why have you never held Mr. Ramoni accountable for his disregard of the public welfare and contempt of civil grand juries by his failure to revise the overwhelming majority of these policies and procedures left over from County Public Guardian Don Moody, who Mr. Ramoni fired? I also asked, you are well aware of the failure of IHSS to serve the public welfare, as evidenced by their ranking 54th out of 58 counties in client reassessment compliance. You are well aware of the history of the toxic work environment in IHSS. As chair of your committee, why have you not held Mr. Menacucci and Mr. Ramoni accountable not only for their disregard of the public welfare, but also for their official misconduct and wrongdoing? To both questions, you replied that Robert Menacucci and James Ramoni do not report to you, and whatever concerns that you have, you confidentially share with County Executive Jeff Smith. Well, Supervisor Chavez, as chair, you're supposed to provide oversight and accountability. As whistleblowers, I, along with recently another employee, have provided the Board of Supervisors thousands of pages of evidence of official misconduct and wrongdoing involving Mr. Ramoni's department. And sadly, I have faced age discrimination and retaliation ever since. In fact, the Social Services Agency has a passion for combating age discrimination against older workers like myself with institutional history. Take, for instance, Laura Marina Atondo, who sent an August 30th, 2019 letter to you, Supervisor Chavez, where she reveals that organized bullying perpetrated by Mr. Ramoni's IHSS management drove her into early retirement at age 54. Note that occurred after she and her female co-workers, all over age 40, met with you, Supervisor Chavez, in March 2019 to plead for relief. So, Supervisor Chavez, why do you do your job? And why are you running for re-election? Is it because you want to do something, or is it simply because you want to be somebody? The county's toxic work environment has traumatized many county workers and their spouses. My trauma and Maria's trauma as survivors of this corruption are valid.
Thank you. Maria? And then Don Eberhard is the only other card I have for public comment. If you want to speak for, I'm sorry, Maria, just one moment. If you want to speak under public comment, you need to fill out a card, and it's not within, fill out a card for public comment, and if it's not within the if it's within the purview of what we're going to be discussing later, I'll ask you to wait till later. If it's something new, then, something not on our agenda, then we can discuss it now. Maria.
Maria Hernandez with SCCExposed.org, that stands for Santa Clara County Exposed.org. Overwhelming evidence demonstrates Robert Menacucci, James Ramoni, and Terry Posley are the epitome of incompetence, bullying, and all what is wrong with the county. Your double standard when it comes to enforcing the law is disgraceful, harmful to the most vulnerable in our county, and wasteful and highly disrespectful to Santa Clara County taxpayers. While the county is enforcing degrees and testing for workers, Mr. Menacucci only has a BA degree. Yet, he supervises many workers with PhDs, master's degrees, and with far more experience than he has. Now, let's talk about James Ramoni. He has a long track record of bullying, incompetence, and disregard of the public welfare, with now some information pointing at mismanagement on conservators and their assets. But despite of all that, and you all being aware of this, you keep kissing up to him and promoting him and protecting him at the expense of Santa Clara County taxpayers. That includes a lawsuit settlement that you paid to my husband for all the bullying that he has endured there. Now let's talk about Terry Posley. Well, she's the program manager at IHSS. What can be expected of a woman whose only verifiable qualification, according to many IHSS workers, is to be a loyalist and a puppet of Mr. Ramoni? No wonder why Social Services Agency is a failure despite of your high publicity and millions of our tax dollars invested in supporting it. IHSS has fallen out of state client reassessment compliance. The Department of Aging and Adult Services has multiple violations and offenses regarding conservative care and management of their assets. The evidence of criminal activity perpetrated by James Ramoni's department is overwhelming and shameful. As reported to you and the whistleblower office by a conservator, multiple abuses and neglect of conservatives are happening under Mr. Ramoni's leadership. When are you, as elected officials, going to stop condoning such incompetence, abuse, and neglect of Santa Clara County seniors? It's not about publicity, it's about deeds. And your deeds, your actions leave so much to desire. There's so many things that are wrong with this. How is it possible that conservatives are not being taken care of? Many of them are not being taken to doctor's appointments, and you know that. You know that because the whistleblower person submitted that, and the whistleblower person sent me also information about what is going on. And you just keep promoting him and rewarding him. Shame, shame, shame on you. Of course, you don't know shame. Thank you for nothing.
So Dawn, Eberhard, Tim, and Gail, and I'm not taking any more. I'm not taking any more public comment, only because we now need to get ready for the rest of the meeting. So, no, the folks who put your cards in, please come forward. So Dawn, Tim, and Gail, and then we're going to move to the rest of the meeting.
Good evening. My name is Don Eberhard. I'm here to actually thank this board and the audience for being here. The issue of senior welfare is very much dependent upon awareness. And relative to awareness, the rights, concerns, comfort, and dignity of seniors at the city, county, state, and federal levels, it many times seems invisible. I'd like to also, on those lines, on awareness, acknowledge that thanks to Tracy Witkowski with ABC7, we have news coverage here. They will be actually broadcasting the outcome of this hearing. The lady that's the news person, Amanda, has interviewed, I believe, some people here, and I want to thank and acknowledge ABC7. They run a Building a Better Bay Area series. I really think that's great, and relative to seniors and giving them an identity and visibility, that's key. Relative to other issues, I've been involved in senior issues for quite some time. I work with an organization called Heart of the Valley Services for Seniors that Supervisor Cortese has acknowledged for their contribution for over 30 years. One of the speakers on general topics list will be Cynthia Rovagni. She is a board member of Heart of the Valley. She will be speaking on item number 3. And she's also a lead scientist and researcher at Stanford Medical. In addition, Leah Cowan is here, who is the manager of government affairs. In preparation for this meeting, I actually spoke to Dr. Liz Velardo, the president and CEO of Sutter Health for the whole state of California, and she was kind enough to get Leah Cowan to attend. And there's a good opportunity for synergy after this meeting in terms of sharing information with presenters, organizations, whatever, to maximize what Sutter Health can do. And last, there's a committee meeting next, or a Board of Supervisors meeting next Tuesday. It will be addressing an agenda item that's not on here, and it relates to the ability of seniors over 65 to apply for, and they have the right to receive exemption from special school taxes, property tax assessments. Hearings have been transpired over the last number of years and months. They've made significant headway. The tax assessor's office has changed the tax bill, and there was a new law passed that basically negates seniors having to apply every year. So that's next Tuesday, and I don't know, Supervisor Cortese, if you want to mention that someplace. But thank you. Thank the panel.
Tim, and then Gail will be our last speaker before we begin our hearing.
Thank you, Commissioner or Supervisor Cortese and Chavez. I'm here tonight to say thank you. I'm here to say thank you on behalf of the Senior Care Commission. We wanted to show you a very heartfelt thank you for the recent budget that you approved, where you took the foresight and the vision to include an adult day services program for the seniors in our community so they can enjoy the benefits of an adult day care program. Your vision is very much appreciated, and we also appreciate you moving forward with the agenda to be a senior-friendly community in Santa Clara County. I'd also like to, on behalf of the Commission, thank somebody else in the room tonight, him and his staff, who guided us and was very supportive throughout this whole process. And as you all know, there were about 3 years worth of work going into this with a lot of people. But it was your final vote that made this happen, okay? But I'd like to give a thank you to Jim Ramone for all his help and assistance that he did and his staff to help us with this process, okay? Now I'd just like to give you just a brief summary of what's happening right now. Since your budget passed, the RFP has been passed. It has been signed off. We're working in conjunction with the Office of Contracts Management. Legal counsel has done it, and as I understand, DOS has signed off on it this week. And the request for proposal is going to be initiated or released, I guess, this Friday. Next week, we'll have a conference call with potential vendors to ask any questions. By the end of October, we hope to have all questions and answers answered, and that all those vendors that want to apply to be the administrator of this program will submit their proposal under the program. We're hoping to make a final selection by the end of the year with the contract initiated before the 1st of January if possible, okay? With that, I'd just like to say thank you very much.
Thank you.
You're welcome. And thank you, Jim.
Gail, and then Bob, we're not at item 3 yet.
Okay.
Yeah, well, I'll call you up in in a little bit.
Thank you, Cindy and Dave. Thank you very much. I'm Gail Osmer, and I'm the chair of the Santa Clara County Senior Care Commission. Thank you for holding this summit for older adults. I just wanted to throw something out at you for our next project. We are taking on a project that we're working with Maribel Martinez from the LGBTQ office, taking on a project of making sure people in that community, the LGBTQ community, we're going to be doing a study like the one they did in San Francisco. We're going to have a huge study, a survey, questionnaires. We're going to be reaching out across the board and working with Maribel on this. It's a very important issue. So I just wanted you to be aware of that. We will be using the same questions and the same format as they did in San Francisco. And we're working with some of those people already and been having meetings. I also just want to tell you that another one of our projects we're taking on is mental health and older adults and suicide with older adults. And hopefully we will have Tony Tellis come speak in November. And all of this is so important, and thank you for all your help and support.
Thank you. What we're going to do, I'm going to invite Assemblymember Kalra up. I know he was waiting until public comment, but wherever he is, if we could, where are you putting him? He has a chair? Oh, great, good. I just want to make sure we weren't floating you across the dais here. So welcome. What I wanted to do is to give each of my colleagues, if Supervisor Cortese would like to make some opening comments, and then Assemblymember, Kalra, and then we're going to dive in. So I just want to talk to you a little bit about the process. We're going to have a report on elder abuse, frauds and scams, mobility and transportation, social participation and volunteerism, long-term service support, caregiving, and a report relating to housing. We're going to have a report also. I wanted to make sure we had an update on Pacific Gas and Electric outages and what concerns folks may have about those. Then what we're going to do is we're going to go to public comment. We're going to let folks speak. We have a little over 21 speakers, so we'll look at the time to determine. Normally we have people get 2 minutes, so if you have more than that to say, you got to get it down to 2 minutes. And then what I'm going to ask is Mr. Ramone and Mr. Mendicucci to give some wrap-up comments and thoughts. The purpose, and let me just say to all of you who are on the dais, the interest we have in having you here is that Supervisor Cortese and I will be bringing forward either together or separately, different initiatives. And the purpose of having you here is both to be able to ask questions of the panelists if something intrigues you, but we're going to wait till we're going to let the panel speak, so write your questions down. And then to be able to have some thoughts as we think about how this comes back to the board, because when we bring things to the board, we bring them in referral format, and they'll then come to you. And so we wanted you to hear the same information we heard before we send you referrals. Is that all right with everybody? All right. So Supervisor Cortese? Oh, well, whoever.
I'll defer to the Assemblyman from the great county of Santa Clara.
Thank you, supervisors. And I thought Supervisor Cortese was in New York, but I guess speaking at the UN, so he made a trip back to be here for this, which I think says a lot. And I appreciate Supervisor Chavez for inviting me to be here this evening. We just finished our legislative session a few days ago at 3 a.m. Saturday morning, to be exact. And so it's great to be back home and not have to go back to Sacramento and to listen to as well as report back on some of the work being done regarding the issues of aging. And I did have the honor of serving as chair of the Aging and Long-Term Care Committee of the State Assembly for a couple of years. I continue to serve on the committee, and so these issues are certainly important to me as well as the governor and our leadership in the Assembly. And a couple of things I'll mention. I do actually have a bill on the governor's desk that has to do with long-term health facilities, skilled nursing facilities, what have you. There was an audit within the last couple of years about the conditions in many of these facilities. And so this bill, if signed by the governor, would strengthen the accountability when there's a death at the facilities, and to give more, give the Department of Public Health a greater ability, not just in terms of finding, but in even citing these facilities and ultimately revoking their permits if they continue to have issues which lead to the deaths of those that are staying at those facilities. We're hoping that it'll improve the overall care, just having that greater level of accountability. And there's a number of other bills. I don't want to get in a legislative update, but I will say that in the budget, with working with both the Assembly, Senate, and Governor Newsom, Governor Newsom did boost both in-home support services as well as a number of other arenas. And most specifically, I will mention that he started a master plan for aging, which actually met. The Stakeholder Advisory Committee met for the first time yesterday in Sacramento, and they came out with their original, the first report on finances and what have you. So we'll continue to report back on the work of the master plan for aging, which I've been supportive of since I was chairing the Assembly Committee. So I'm very grateful to the governor for launching that. And I think a lot of what we need to do it as a state, frankly, the county's already doing. And I really attribute that to the leadership on the board. And I oftentimes take back some of the work being done here to Sacramento to really push it at a statewide level, as well as bring more resources here. But I think what's happening here really can be a model in many ways, given the fact there's still a lot more work to do. I think that we're heading in a very positive direction. And trust me, when I'm in Sacramento and talk about the things happening here at the county and the collaboration, a lot of my colleagues are very jealous. And so thank you for helping to guide me in my efforts to represent the community, and most specifically our senior community, our aging community, to make sure that we're doing everything we can, and especially in a high-cost area like Santa Clara County, to make sure that we're supporting the vulnerable community that's given so much to build Silicon Valley, and I think it's certainly our obligation to care for them.
Thank you.
Thank you, Chair Chavez. And I know that you run a tight meeting, so I'm going to try to be concise, but I want to make sure to mention a couple of things. First of all, one of the first things we have to recognize is, I think we would all agree, is despite the fact that there's a few of us seniors in the room, especially by definition of 60 or older, I'll join that group. I have joined that group. But there's mobility issues, and one of the things we did was to go out with a senior care survey prior to this hearing, and kind of crisscross the county at senior nutrition lunches, at other senior gathering places, community-based agencies, to give people an opportunity who couldn't be here this evening to weigh in, to say what their top priorities were. And although we allowed an other item, which was kind of open-ended, and we got a whole bunch of things we weren't expecting that are important to know, the highest priority today was physical health care at 74%. In second place, long-term support and services at 73%. No surprise at number 3, mobility transportation, about 66%. And we're still counting. These are still coming in by mail and being turned in by groups. And then housing, about 62%. So, you know, all in all, there were thousands of these that went out. Of course, with any kind of a voluntary survey, you're going to put out thousands and get back hundreds. But I think it's not only a good sample for us, but again, I think it augmented this public process so that people felt like their opinions mattered out there. And I think it's just something we probably all want to continue doing, is to continue using every tool we have available to make sure real two-way communication is going on. The county has a great history, as you know, of late. And when I say of late, I mean at least the past decade. We convened the county's first older adults summit some years ago. In 2017, we became the first county in the United States of America to have all of its cities in the county, including the county, be a part of the World Health Organization's global network of age-friendly cities.
That is a big deal.
So yet another national first for the county, but again, knowing we have so much more to do, especially given the population increase I'm sure we're going to hear much more about this evening. But over the next 10 years, it's not just an observation, a demographic observation, that the population is going to perhaps double, but if not double, get up from where it stands now to about 27%. It raises the issue, besides observing that, are we calibrating our budgets? Are we restructuring the way we do things in order to keep up with that growth? And then I also want to mention, you know, since 2016, and perhaps even prior to that, you know, something that one of our former colleagues, Liz Niss, was spearheading at the time, the whole Board of Supervisors got behind, was something we call the seniors agenda, which I imagine half or more of the people in the room are familiar with or have participated in their convenings, which has just become a great opportunity. And again, in terms, I hope everyone, in terms of outreach, whenever they're among seniors, lets them know that the seniors agenda is taking their comments year-round, not just once in a while when there's a special hearing like this. Lastly, I do want to thank Don Eberhard. He spoke under public comment for his effort in bringing really extraordinary local attention and even regional attention to this issue of parcel tax exemptions. Supervisor Chavez and I held a special hearing just on that subject, invited all our education partners, the school districts here, just a few weeks back. And the next report and the next discussion on that topic is what Don was referring to is on September 24th, so that's coming forward. But I'll give you a sneak preview. You know, he and a lot of other seniors were telling us it's a difficult system. It's often hard to get your exemptions. You know, it's hundreds of dollars for a senior, and it should be automatic. The legislature has acted recently to try to force the process to be more streamlined. But Cindy and I put our staff to work, and I'm talking about the county administration here, the county, the tax collector's office, the recorder's office. You know, we went right to where the records really are. And the sneak preview I want to tell you isn't necessarily good news. We figured out that there are about 42,000 seniors and individuals with disabilities who are eligible for parcel tax exemptions in this county, and only about 62% of the eligible are receiving parcel tax exemptions. Those lucky 62% are getting $7.7 million collectively, but the other 40%, approximate 38%, are leaving a whole bunch of money, millions and millions of dollars on the table, and we're going to keep working at that and getting that resolved here in this county. But Assemblyman Kalra, obviously, all 58 counties probably need to make sure that 100% of the folks that are entitled to those parcel tax exemptions can collect them without having to jump through hoops or, get into paratransit and take trips down to the school district. I think those are some of the problems that people are facing. So with that, Supervisor Chavez, sorry I couldn't be a little more quick with my comments, but thank you for the opportunity. I appreciate it. And thank you to you and your staff for doing your usual excellent job of leading the effort to pull this hearing together. Thank you.
Thank you very much. I am going to just make one quick comment, and that is just for all of you. I know a lot of you want to give feedback, and so we're going to go through a whole series of presentations. Each speaker we've invited could talk to us on their own for 1 hour, and we've given them all 5 minutes. And so we're going to run the timer really just to keep people on board. And I see Vaughn, he said 7. No special treatment. But I do want to say it's not out of disrespect for how brilliant these folks are. We really, I think, have analyzed problems to death. They're really here to talk to us a little bit about the problem and a lot about solutions. So with that, I'm excited to introduce our first panel. And this is regarding elder abuse, frauds, and scams. Paul Greenwood, retired district attorney and elder abuse division from the County of San Diego. I just transplanted him. County of San Diego is joining us, and Valerie Smith from Adult Protective Services, our Adult Protective Services manager at Santa Clara County. So welcome. Thank you for being here.
Thank you very much. Good evening, everybody. My name is Paul Greenwood, and as you said, I'm a retired deputy DA from San Diego, and I've been a lawyer for 41 years, same time as I've been married, and for the last 25 years was as a prosecutor in San Diego. I've lived in that county for 28 years, obviously coming from the UK, no surprise to you, I'm sure. And for the 22 years out of the 25, I prosecuted one crime called elder abuse. And typically in our office, we would do one specific area of prosecution for 2 to 3 years and then move to something else. After a few months of January 1996, I realized this was something that I wanted to make my career in because it was totally ignored, uninvestigated, unprosecuted, and because I had been blessed by 2 parents who were part of the World War II generation. I am one of those people that happens to believe that the World War II generation is our finest generation, partly because my dad was a B-25 bomber pilot and served 79 bombing missions and was shot down and rescued by Yugoslav fishermen, and partly because those men and women deserve the respect that sometimes they never get. So I prosecuted under the crime section called 368. We define elders in the criminal code as anyone over the age of 65. One of the reasons I retired was because I was 66 and some of my victims were younger than me. So that's not very good. So I'm on Medicare now and Social Security. I am an elder. And I feel very passionately about this subject, which covers homicides, rapes, neglect, financial exploitation, false imprisonment, mental torture, you name it. It happens to so many seniors. The first thing I want to share is the reality check. It's already been mentioned about the growing population. Over the next 15 years, the senior population in California will jump from 5.4 million people to 10.3 million people. And I'm so glad that Governor Newsom has decided to create this master plan. It's so much needed. I'm glad the Assemblyman referred to it. And one of the recommendations written by over 100 agencies just this last week into the master plan is that a strategy should be put in place to prevent elder abuse, exploitation, and neglect. One of the big issues that I go around the country now talking about is the inadequacies of funding for people in the adult protective services realm. It is absolutely tragic and ridiculous that typically in so many counties, there's 1 APS worker to every 5 child protective service workers. That is wrong. And we've got to understand that if we do nothing about that, there will be an avalanche of cases of victims of elder abuse that will never get reported, never get investigated because of the lack of resources. So we've got to bring this to the attention on a federal level and on a statewide and a county level. I want to share three major hotspots with you. Number one, the fact that in assisted living facilities and nursing homes around the state, so many serious crimes are going unnoticed, unreported, uninvestigated, particularly sexual abuse of elders. I don't know if you know that within your county there are over 290 assisted living facilities in this county. And if your county is anything like San Diego, there are many crimes going on right now in some of those facilities that will never get reported to the sheriff or the police and never get prosecuted. That has to change. Unfortunately, in San Diego, the Board of Supervisors did something about that 4 years ago, which allowed me to form a task force, which I would love to see happen in this county, and it's very easily done. I've made some inquiries already before tonight's meeting, and it can and should be done. The second area is conservatorship, guardianship abuse. I would like all of you to watch the movie called The Guardians, and I was shattered when I watched it. Because to think it can happen in the United States of America, it is happening, and it's happening all over the country, guardianship abuse, and we have to bring attention to that. The third area is just pure scams. How many times today have you had a robocall? Seniors are being targeted like never before, and they're losing life savings, and so often their pleas for help are being ignored because of overwork by the police departments and by the federal agencies. That has to be looked at with task force, and I think collaboration is the key, and we can make it happen here in Santa Clara County. Thank you.
Thank you, Paul.
Good evening, everyone. My name is Valerie Smith. I'm a program manager with Adult Protective Services in Santa Clara County. I'm proud to be here and honored to be invited to speak in front of you today. I also want to acknowledge some Adult Protective Services social workers that are in the audience. And also my fellow DOS colleagues, Department of Aging and Adult Services, that are also in the audience over here. I speak on behalf of Adult Protective Services, but really my comments can be attributed to all programs in the Department of Aging and Adult Services. Let me just begin by saying all people, regardless of age or disability, should be able to live independently and participate fully in their communities. Every person should have the right to make choices to control the decisions in and about their lives, also known as self-determination. In survey after survey, when older adults and people with disabilities are asked where they would prefer to live, they say they want to live in communities, not in institutions. Living in the community can also offer a level of social connection that is hard to find in a nursing home or other institutional settings. And there are many benefits both to the individual and the community. It also happens to be less expensive than other options for most people. As you know, costs for nursing facilities and public residential facilities can range anywhere between $75,000 and $225,000 a year. In most cases, these costs are not covered by Medicare or private health insurance. A series of laws, court decisions, and administrative rules have established community living as a legal right. Most notably, in 1999, the U.S. Supreme Court ruled in the Olmstead versus LC that people with disabilities must receive services in the most integrated settings possible. This landmark decision has been a critical tool in protecting the rights of people with disabilities and older adults. In Santa Clara, Santa Clara County Adult Protective Services Program provides a critical safety net to protect elders and dependent adults from abuse and prevent abuse. As the elder population continues to grow, as been previously mentioned, this continues to be challenging to provide services. There are fewer services available to older adults and people with disabilities, and cases that APS are receiving have become more complex because we have become a default to receive all types of cases, not just ones that are abuse and neglect. Just a few words about the population increase that's been mentioned already. Every year, the numbers of abuse reports received and case investigations are increasing at unprecedented rates. We've averaged 14% each year over year from 2013 to 2016 of the increases. In fiscal year 17, we jumped to 20%. In fiscal year 18, we had a leveling effect, but so far for FY19, we're on track to see double-digit increases once again. The ability to meet services needed in the traditional way have become ever more challenging. In just 7 years, the aging population, age 65 and older, in Santa Clara County is expected to be 17.4% of the population. While populations served by other social services agencies remain flat or declining, the aging population will continue to grow at unprecedented rates, as shown here on the chart. We have seen the growth in these often it's talked about a future of growth, but it's happening now. Our programs in DOS are feeling it now. APS is feeling it now. We, in Adult Protective Services, we have 31 social workers right now. We do have 6 vacancies, which I'm happy to say, are about to fill, but that is still not enough for a county our size to be able to meet the need. So several of the issues that I've talked about are poverty, lack of safe and affordable housing, increasing medical costs, and transportation. And the solutions to look at, as Paul mentioned and many others have mentioned, are increased public awareness, early intervention, collaborative practices, coordination of services, and a serious look at sustained staffing augmentations to the programs in the Department of Aging and Adult Services. Thank you very much.
Thank you. Now, everybody, that's how you do it. So let's get, well done. If we could call up our mobility and transportation team, and that is Tyler and Vanessa, and welcome. And thank you both very much.
Thank you. Good evening. My name is Tyler Taylor. I'm the Executive Director for the Saratoga Area Senior Coordinating Council, or SASE for short. I also serve on the Santa Clara County Senior Care Commission. We're here tonight to talk about transportation. And as you can see, there's a mix of our transportation programs here in the county. Santa Clara County has 5 existing volunteer driver programs serving adults age 65 and over. Avenidas in Palo Alto, a fabulous organization who does a lot of great work in the community, has a program called Door to Door. Heart of the Valley Seniors for Services, Inc., the Portuguese Organization for Social Services and Opportunities, Morgan Hills Getting Around Town, and the RIDE Senior Transportation Program operated by my organization, as well as West Valley Community Services in Cupertino. Together, these programs provide 14,000 rides to Santa Clara County seniors, and that number is climbing, and that's per year. As this population ages, programs like these will not only increase in value, but also in necessity. Even with the introduction of autonomous vehicles within the next 10 years, which is talked about quite frequently, people in this demographic will always need human interaction and personal contact. Ride-sharing companies cannot provide the price point nor the level of training and specialization necessary to meet the complex needs of this population. And many of these programs, all of them, are underfunded, disconnected from the established network of county resources, and misunderstood as it relates to their value. One of the very important things that happened, and I want to thank the Department of Aging and Adult Services and Diana Miller with the Senior Agenda for putting together a regional volunteer driver program summit in January of this year. We talked about universal successes and challenges, our shared learning, and as well as actions and next steps. Our successes were really around getting isolated seniors out of their homes and back into the community, enjoying the things that they loved about their community, connecting them with the additional resources and support services that are offered by the organizations that are providing these programs, and filling the gap in last mile transportation options. The challenges that we commonly face in our programs are volunteer driver recruitment and retention, managing the excess demand for our services as word spreads about the availability, the financial strain that comes because all of us are community-based organizations that are competing with ourselves, with our other programs for transportation for the dollars that are available, and remaining viable while offering these services at an affordable rate for seniors. The shared learning that we've benefited from by this summit was software solutions, sharing best practices and operations, learning about the disparate relationships that Uber and Lyft have with senior transportation providers in the county, as well as gaps in service, non-English speakers, wheelchair-bound individuals who may live out of the service area of Access and VTA, seniors living in rural areas as well. Our action items that we came up with at this summit were to continue meeting with regularity, sharing our best practices as well as referrals, conducting research into Uber and Lyft agreements across senior service agencies and senior residential communities, and drafting a white paper to illustrate our findings, and to promote and support each other's programs. We have some recommendations before I go to that next slide. We have some recommendations. Our recommendations are to continue to support volunteer-based senior transportation programs through funding, access to resources, and integration in partnership with other county departments such as DOS, HHS, and mental health. We'd also like to encourage VTA to provide training, technical support, and marketing and promotion of these programs to their clients as an extension of their mobility management program in those areas where they are no longer currently serving. Meeting with members of our collective, we would love to meet with the Board of Supervisors and their representatives to discuss ways that Uber and Lyft could be brought to the table to provide excess service as well as uniform pricing to senior service agencies in this area, and to allow DOS and the Seniors Agenda to continue to host these meetings for our group to promote shared learning, best practices, and the successful continuation of these valuable programs. This next slide here, RIDE Senior Transportation. We have applied for the FTA 5310 Operating Assistance Grant. If our grant is successful, this is what our coverage map will look like for the RIDE program. Our current area is in purple. We're serving Saratoga, Cupertino, Campbell, Montecito, and Los Gatos currently. The blue area is our planned expansion into the San Jose area. We're looking at heading more towards South County, but we also see pockets that we'd like to test out and figure out, especially in the 95122 zip code in East San Jose. The green area is Morgan Hill. Again, South County is traditionally underserved when it comes to transportation options for seniors, and they have a wonderful program that we want to partner with in Morgan Hill by a great team of people there. Thank you very much for your time and your support, and we appreciate it.
Thank you very much.
Applause. Tough act to follow, right?
There you go, Vanessa.
Good evening, Supervisor Chavez and Cortese and esteemed members of the dais. My name is Vanessa Merlano, and I'm the County Senior Nutrition Program Manager. We provide meals at 40 dining sites throughout Santa Clara County for all adults 60 and over. You're welcome to come, Supervisor Cortese, regardless of income. Through the Mobility Management Program, we provide more than 1,000 bus passes every month to income qualifying individuals to reduce transportation barriers that would impact their ability to participate in the senior nutrition program. In addition, I'll advance the slide. In addition, we cover the cost of paratransit services to and from dining sites. Food insecurity is defined as the disruption of food intake or eating patterns because of lack of money and other resources. In 2017, Feeding America released The State of Senior Hunger in America, a report that found that 7.7% of older adults in the nation are food insecure, that divorced older adults have 2 to 3 times higher rates of food insecurity in comparison to their married counterparts. Older adults that are 60 to 64 have twice the food insecurity compared to people that are 80 and over. And food insecurity and very low food security rates are substantially higher in older adults that are raising grandchildren. I think very importantly, we should take note that in the San Jose, Sunnyvale, and Santa Clara metropolitan area, they found that we have a food insecurity rate of 11.5%. This is the 3rd highest in the nation for a metro area. Many factors contribute to food insecurity, but it is especially important to note that food deserts or communities that lack affordable nutritious foods are especially impacted due to lack of transportation. Locally,
The average distance to a nearest full-service grocery store is 1.25 miles. This can be a significant barrier for many older adults. Healthy People 2020, Social Determinants of Health, identifies food insecurity as a key issue. They found that residents are at risk for food insecurity in neighborhoods where transportation options are limited, the travel distance to stores is greater, and there are fewer supermarkets. Groups who may lack transportation to healthy food sources include those with chronic diseases or disabilities, which are a big part of our older adult population, residents of rural areas, and some minority groups. Common transportation barriers include lack of mobility, changing mobility options such as the removal of a driver's license, income and access to support networks. Some other issues impacting transportation in our community include high crime areas. In the county, the average number of violent crimes within 1 mile of a residence is 16%. For the neighborhoods highlighted on that slide right there, it's greater than 30%. People may not readily access senior centers if they don't feel safe walking or driving to the center. We know that 48% of motor vehicle collisions are within 1 mile of a Santa Clara County senior center. Only 5% of our residents live within half a mile of a regional transit and within a quarter of a mile of a bus/light rail. The last mile, highlighted by Tyler just recently, can make a huge difference for individuals with mobility obstacles. So in light of the information that I've presented, some of the recommendations that I'm putting forward to address transportation gaps in our communities are: first, to expand meal delivery to low-income senior housing via food trucks. To increase access to free public transportation vouchers and passes to all low-income older adults. Increase partnerships with rideshare companies and really leveraging the technologies and applications that they use. Providing vouchers for those rideshare companies. Offering safe transportation mobiles or caravans in areas impacted by high crime. Creating a one-stop mobility management center, fully staffing the Senior Nutrition Mobility Management Program, enhancing partnerships, again, I know that was echoed previously in elder abuse, but enhancing partnerships with mobile food delivery programs and supporting volunteer driver programs. Thank you so much for your time.
Thank you. Thank you both very much. The next section is social participation and volunteerism. So we'll invite up Deborah Odom, the project director for RSVP San Mateo, Northern Santa Clara County, Sutter Health, and Sherry Burns, chair of the Aging Services Collaborative. Welcome.
Can you hear me? Okay.
Welcome.
Good evening, and thank you for this opportunity to share my passion for volunteerism. I've been told I have 5 minutes, so I will do my best. I'm Deborah Odom. I'm the program coordinator for RSVP of San Mateo and Northern Santa Clara counties. How many here are familiar with RSVP? Oh, maybe a few. RSVP is one of 3 programs that make up the Senior Corps, the other 2 being Foster Grandparent and Senior Companion Program. Senior Corps is administered by the Corporation for National Community Service, which is a federal agency. We're authorized by Congress and funded through appropriations through Labor, Health, and Human Services. We are grant programs locally sponsored by nonprofit organizations. I happen to be sponsored by Mills Peninsula Medical Center in Burlingame. In 1965, the Community Service Society in New York launched a pilot program in Staten Island, which involved a small group of older adults in volunteer service to the community. They demonstrated beyond a doubt that the value of services of older adults led to the amendment of the Older Americans Act and created RSVP. RSVP was launched in 1971. So if you've not heard about it, I like to say that we're the best kept secret in town, which isn't necessarily a good thing. Each year, the corporation releases data about how Americans are providing services in their communities. In 2017, 1 out of 3 adults volunteered through organizations, demonstrating that volunteering remains an important activity for millions of Americans. The overall volunteer rate increased by more than 6%. Volunteers donate to charities at twice the rate of non-volunteers. Volunteers invest in community building. They did something good for the community at 3 times the rate of non-volunteers, and did favors for neighbors at nearly twice the rate of non-volunteers. Generation X, those born between 1965 and 1985, had the highest volunteer rates amongst age groups. Baby boomers had the highest number of hours that they reported serving. They're not working. And millennials, they've gotten the volunteer, they've been bitten by the bug. Their volunteering increased more than 6% since the last report. Next. In the data that they put out, look how California ranks, 47th. That's pretty sad. Can you guess which state ranked the highest? Think about the faith-based community. Utah. But California does rank 13th in regards to the number of veterans who serve their community. The metropolitan area of San Jose, Sunnyvale, and Santa Clara County, though, ranks 18th out of the top 25 metropolitan service areas in the country. The benefits of volunteer service. Volunteering in America is an American value, with people giving their time without expectation of compensation. While volunteer activities may be performed, 1 minute, oops.
Yeah, you might want to get
With
to
the
that
intention of helping others, there's also a
Get to that
common
last
thought
slide.
that those who give of themselves also receive. A 3-year longitudinal senior focus study, Senior Corps volunteers over 1 year, nearly half reported improved health and well-being. Almost 2/3 of seniors volunteers report a decrease in feelings of isolation, and 70% of Senior Corps volunteers who initially reported 5 or more symptoms of depression reported fewer at the end of their first year. Let me tell you a real quick story about Lily Hioki.
Deborah, I'm going to suggest you get to your recommendation slide,
Okay.
because I'm going to end you right in 24 seconds.
Okay.
23.
Very sweet lady. Has been volunteering for 30 years with the Monkey Toys in Los Altos. Okay, here's my recommendations. For a county-wide database to capture what is really happening in Santa Clara County. With the age-friendly movement, volunteering was one of the domains, but each city is tracking it separately.
Okay, I'm going to leave your slide up for a moment, and I'm going to go right to Sherry. You did great, but I'm going to stay on record, and we can see your recommendations. Thank you. All right, Sherry, you're up.
All right. Am I on? Okay,
Yes.
good. Thank you so much, and thank you for the opportunity to talk about the other aspect of social participation. First of all, I want to, I guess, forward here on, there we go. So I'm here representing tonight as the chair of the Aging Services Collaborative of Santa Clara County. My paid day job is I'm the executive director of Silicon Valley Independent Living Center, and we are one of the agencies that is part of the consortium of organizations and individuals that work together to provide leadership and build community-wide capacities to support, maintain, and promote the well-being of older adults, people with disabilities, and their caregivers in Santa Clara County. We have 3 main focus areas: affordable and low-income housing, long-term services and supports, which support the California Master Plan for Aging, and older adult wellness and social inclusion. I'm going to focus on the last aspect of social inclusion and participation. So the issue is, there's a couple of components to the issue, is that we have a lack of awareness, a lack of opportunities, and a lack of access for older adults and people with disabilities of all ages to engage in volunteerism and social inclusion, which adversely affects health and well-being. There are 3 quality of life elements for all of us. 1 is physical environment, 2, supportive services, and 3, social and emotional well-being. In fact, studies have shown that social isolation has the same health unbenefits, if you will, of smoking 15 cigarettes per day. That's how it affects people's health physically and their emotional well-being. I spent the last 2 days with 38 other aging collaborations and coalitions in Sacramento discussing the issues we are addressing here this evening and how we as a state and within our local communities here and in Santa Clara County can create a comprehensive master plan for aging, which Assemblymember Calwer spoke of. We spent a lot of time talking about those 3 areas of quality of life, and social and emotional well-being being a significant part of that. Some of the solutions that we can look at with regards to engagement and activity is things that support people's purpose in life. People want to feel at all ages that there is a purpose to their being. And this results again in better physical and emotional health. We can provide more adult daycare and supportive senior social programs within Santa Clara County. As was mentioned previously, and thanks to the Board of Supervisors and through the urging and recommendation of the Senior Care Commission, we've just approved funding for a new adult daycare program in the county. We need more of these kinds of solutions here in Santa Clara County as our population of people with disabilities and older adults increases. We need to provide options for free and or subsidize accessible transportation to and from sites through public transit, paratransit, ride-sharing programs, accessible Uber and Lyft TNC programs, and other kinds of low and no-cost on-demand transit services. I'm going to sound like I'm echoing what Tyler and Vanessa just covered, but this is essential for connecting people from where they're living to social engagement opportunities for them. We need to increase awareness of and access to friendship line type programs like Institute on Aging has developed over the past year for less mobile people so that they can connect with others in their community and talk to others. There's also a program that operates in Alameda County, Seniors Without Walls, which is an online senior center essentially, and they have book clubs and all kinds of wonderful opportunities for people who are less mobile to connect with others in their community and have that kind of engagement for their emotional well-being. Other recommendations and solutions would be increasing our volunteer and mentoring opportunities, increasing intergenerational programs such as a Grand Friends program with preschool and grammar schools. Children and older adults can benefit from working together, no wrong door approaches, and caregiver support systems. And lastly, I would just focus on the exploring options to expand subsidized accessible transportation services for our older adults to connect to volunteer opportunities and social programs.
Thank you both very much. That was a lot to cover. Thank you. We're now going to move to long-term services, support, and caregiving. So Vaughn and Grace, if you could come forward.
Thank you very much, Supervisor Chavez and Supervisor Cortese, for organizing this event and for allowing us to speak on this issue. Again, my name is Vaughn Villaverde, and I'm the Associate Director of Health Policy at Working Partnerships USA. I also staff the Santa Clara County Long-Term Services and Supports Integration Committee, which is a coalition of over 20 organizations and county offices whose mission is to develop policy recommendations and actions that will provide patient-centered, responsive, and coordinated long-term services and supports for older adults and people with disabilities in the county. So I wanted to start by first defining long-term services of support, long-term services and supports, or LTSS. Generally speaking, LTSS centers around helping older adults and people with disabilities with activities of daily living and instrumental activities of daily living, and I've listed some examples on the slide up there. I did want to note that while these services can be provided in the home or at clinical settings, for the purposes of today's presentation, I'm going to be focusing primarily on home-based LTSS, since that's what we're seeing the highest need among older adults are. So what's the problem? In a nutshell, it boils down to high demand, low supply, and lack of coverage options, which means patients have to pay out of pocket. In terms of that first issue, it's pretty clear that there's a high need for LTSS services in the county, but we don't really have a clear idea of exactly how high that need is. Most data collection is focused on those receiving in-home supportive services or IHSS through Medi-Cal, but that doesn't provide a complete picture. For example, older adults who need LTSS but don't qualify for IHSS often rely on family members and close friends to receive this home-based care. And there's virtually no data being collected on a systematic basis about this population. So not only does this lack of understanding prevent us from accurately estimating the need, but it also prevents us from addressing a lot of the downstream issues that are associated with family caregiving, from lack of training and support for the caregivers to caregiver burnout. And this actually leads to the second problem, which is that the current caregiver workforce can't even meet the current demand, let alone the projected demand with the aging population. And frankly, a big driver behind this is low wages and poor benefits. There are also very few opportunities for advancement for caregivers, and there are no real standardized trainings or to build skills among caregivers long term. And actually, the California Legislative Analyst's Office estimates that the annual turnover rate for IHSS workers in the state is about 33%. So on top of these two issues of high demand and low supply, costs are also rising with very few options for getting coverage for these services. So if you look under number 3, the first two bullets, they show the current and projected cost of receiving 40 hours of care for a whole year. And as you probably can guess, that's very unaffordable for a lot of older adults on fixed incomes. Medicare and private insurance plans typically don't cover LTSS, which again drives many who need LTSS to rely primarily on family and friends to get this care. Fortunately, there are a number of ongoing efforts at the state and county levels to address these critical issues. The first is the Master Plan on Aging, which provides a framework for addressing these issues. The Future Health Workforce Commission is a statewide effort that's trying to actually make caregiving jobs more attractive by creating pathways for advancement and for them to build skills over time. At the county level, there's also the California Area Health Education Center, or AHEC, which provides, which is trying to create a long-term pipeline for workforce development for health careers. And the LTSS Integration Committee, which again I staff, is also working on some county efforts on this. Sorry. And then in terms of recommendations, recommendation number 1 is to commission a comprehensive study to really figure out the need in the county. Number 2 is continue supporting local and regional efforts to strengthen or establish LTSS housing programming and policies. And number 3, continue advocating for increased coverage and access to these kinds of services. Thank you very much.
Great, thank you.
Can you hear me? Wonderful. Good evening. My name is Grace Alderson. I'm a senior community health planner at the Public Health Department, and I'm delighted to be here tonight to share some pressing findings about the state of oral health among our county's aging population. In 2018, in collaboration with the Collaborative for Oral Health, we conducted a comprehensive needs assessment to identify the oral health needs, resources, problems, gaps, and best practices and trends in our county. These needs assessments also identified some of the high-risk populations for poor oral health outcomes, and our senior population was one of those populations listed. So tonight I'm going to share some of this data related to barriers to access and utilization of accessing dental care and some recommendations and solutions as well. So in our county, we have the lowest dental health insurance coverage among seniors compared to any other demographic group. You can see in this slide that less than half of older adults have any coverage. A main reason why this might be is because Medicare does not provide any dental services, and so many seniors cannot afford to pay the high cost of dental care, both preventative and treatment services in our county. In a recent field study from this needs assessment found that less than half of older adults in our community have lost between 1 and 5 teeth. Over a quarter have lost 6 or more teeth, and 8% have lost all teeth. And this is all due to gum disease or tooth decay. And this is a tremendous issue because we need our teeth, we need healthy mouths to communicate, to speak, and to smile. And being unable to do so can really perpetuate feelings of embarrassment and social isolation as well, which we heard about. This also is linked to the inability to eat, which we know we need to eat healthy food to prevent cardiovascular disease and type 2 diabetes. So when someone's experiencing pain in their mouth, this makes it extremely challenging. And we can see that our rates are lower than the California state target. We also found that 68% of older adults visited the dentist or a dental clinic in the past year. 13% went due to dental problems, and over a quarter report a time in the past year when they needed dental care but were unable to receive it. I will point out that Medi-Cal does cover dental services, although we find a very low utilization rate of those services in our community. So this needs assessment was a mixed methods approach from surveys and focus groups and key informant interviews to really find out why there's low utilization rate. And so some of the barriers to utilization are the following, and I'm going to couple each barrier with a recommended solution that came out of this needs assessment. The first is a confusion about how to best take care of teeth because changes in oral health care practices evolve over time. You know, when we're younger, we often solidify, our habits related to health and hygiene. And if you aren't receiving updated and continuous health education and information, you may not be following the most up-to-date best practices for optimal oral health care. So we're finding that this is a major barrier in our older adult population. We recommend launching wider community outreach and health education to reach older adults to make sure they're implementing and using the best oral health care practices out there. Another is transportation, which you heard from tonight, but making sure that older adults are aware of the Medi-Cal transportation benefits and making sure that other driver programs out there include support in getting older adults to their dental appointments. As I mentioned earlier, costs due to limited insurance. We recommend expanding low-cost dental services and enhancing dental clinics with mobile and virtual modalities to reach populations in more rural parts of our county. Another major barrier is a past negative experience at the dental office, and this problem is really twofold. First, there are physical and structural barriers, so not all dental clinics are ADA compliant, nor do they all have dental chairs that are particularly comfortable or accessible to somebody with low mobility or of an older age bracket. Second, not all dental providers are trained to work with this population, and so we're finding that not all dental clinics are age-friendly. So we recommend increasing the number of dental clinics that are age-friendly, both physically and I guess interpersonally as well. And finally, we understand there are competing priorities focusing on housing, food, and other issues, but we've identified opportunities for integration of dental services into other community services and home visitation programs that exist. This needs assessment resulted in the formation of a community health improvement plan dedicated to oral health. This is spearheaded by the Public Health Department and the Collaborative for Oral Health. It's operationalized by 6 work groups, 4 of which have met so far this summer and into the fall. One is dedicated exclusively to older adults, and we have the wonderful support of our social service agency and many community stakeholders driving forth many strategies and recommendations outlined in this plan. Thank you so much for your time tonight.
Thank you very much. Really good information. We're next going to move to the housing panel, and that will invite Bob and Fred up to talk about housing. Welcome. Welcome.
Welcome. Good evening, everyone. Are we good to go? Or am I
You need to turn your mic on.
Oh, thank you. Check.
There you
All
go.
right, now we're good. I think we're ready to go. My name is Bob Stromberg. I work with Destination Home. We're a nonprofit organization working to end and prevent homelessness throughout Santa Clara County. Specifically, I manage our Housing Ready Communities initiative, which works to build and activate support for the housing we need to end and prevent homelessness. Before I move on, I want to ask everyone here, do you want the good news or the bad news first? Okay, we'll start with the bad news. I'm going to do some bad news, some good news, and then what's missing, or more positively, where are our opportunities? It's an honor to be here. If we look throughout the county at the count that we do every 2 years in terms of total homelessness in our community, the total number is greater than 9,000 today. A full 43% of those are over 51 years of age, and that's a number that has increased dramatically in recent years. For example, in the last 3 years, more than 3,000 older adults have entered our system for the very first time. Even more shockingly, 50% of those who are over 50 and are experiencing homelessness experienced homelessness for the first time after the age of 50. That is to say, these are not individuals with a long-term history or experience of homelessness. They have aged into homelessness. And it really points us to where some of the action needs to be. This is also indicated by 20% of those who are accessing services of our pilot homelessness prevention system are also older adults. This leads us to take a little bit of a look at ELI. This is extremely low income, refers to the lowest income bracket in terms of how we classify affordable housing and those who qualify to live there. We have more than 65,000 households that are renters in our community that fall into this category. 70% of them, or more than 46,000 families, are paying more than 50% of their take-home pay in rent. 26% of those ELI households are over the age of 62. So this is clearly a category that includes predominantly, to a large degree, the older adults in our community. Luckily, now the good news, our system is responding to the needs of older adults in terms of those moving into supportive housing from homelessness at approximately the same rate as the total homeless population. So 40% of those in our supportive housing system are older adults. In fact, in the last 3 years, we moved more than 1,500 individuals from homelessness into supportive housing. Currently, that's roughly 50 every month. So that's progress. What does that look like in our county? Currently, we have supportive housing in 50 or more, in more than 50 apartment buildings throughout the county in 10 of our cities. The blue box on the left that you see refers to the County Measure A Affordable Housing Bond specifically, that has financed 19 housing developments that will create more than 1,400 homes. 38% of those are explicitly dedicated to older adults. Older adults also, of course, qualify for those that are not specifically set aside for them. So moving on to recommendations, we have some images of some of those developments that were financed by the Affordable Housing Bond, completed or underway. The first is on production. We need to continue to focus on the production of extremely low-income housing and supportive housing, simply because if we do not prioritize that development, it does not happen in the market. Along with that, we need to make sure that all development includes universal design ordinance standards, so that those who live in housing, be it affordable or Measure A funded or not, are able to remain in their homes later in life. Some of the transit issues that were mentioned earlier are also very important. Development needs to happen near transit, and we should work on ways to provide transit passes with our public transportation providers at a higher rate. My second suggestion is to continue support of our homelessness prevention pilot system and to grow that to meet the needs of older adults. And that leads to the third recommendation, which still needs some fleshing out, and I hope that we'll be having more conversations in the community in the coming months about this. And that is that even if you're in affordable housing, you run the risk of losing your home and falling into homelessness. I met a gentleman just 2 weeks ago who was in his early 80s, lives in affordable housing, so one of the lucky ones, but spends 81% of his income on rent, leaving him $117 per month to survive. We need to find gap funding that's ongoing to meet that need and keep people in their homes. Thank you so much.
Thank you. Bob, Fred. Welcome.
Yes. Thank you, Supervisor Chavez and Supervisor Cortese and members of the committee for having me here. My name is Fred Buzo. I'm an Associate State Director for AARP California, based here in San Jose. And so, you know, as Supervisor Cortese said earlier, we are aging. And we are aging rapidly, not only as a nation, as a state, but as a county. And so this isn't a hypothetical, this isn't, you know, sort of a random projection, is a reality. And so we're gonna have to deal with that. And so we have to think about in terms of, you know, yes, we need housing now, but we also need to plan for housing in the future and how we are going to build that housing, not just in terms of funding, but what is that housing going to look like? So most older adults, and quite frankly, even younger people, want to remain in their home as they age or at least remain in their community. AARP found that across the country, about 3/4 of folks want to stay in their home or live in their community as they age, particularly older adults. In Santa Clara County, that's even higher. And why not, right? This is a great place to live when you have a home. And so most people want to remain, but what is it going to take to have these folks remain in their homes? So one thing is, and I know, you know, it's a difficult situation to talk about with the county because you have all the cities to deal with, but proper land use planning is absolutely critical to building housing. You can't talk about housing without talking about proper land use planning. And so in building age-friendly cities and livable communities, you know, we don't mean people for old people places. We don't mean we're just going to put older people out on a farm somewhere. We're not going to segregate them, you know. They want to live in communities with people, with others, with folks of all ages, all income abilities, and all physical abilities. And so we want age-friendly and livable communities to be great places for people of all ages to live. So what we're talking about here is housing choices, housing options that are suitable for people of all ages and life stages. We wanted to reduce automobile dependence and support a socially vibrant public realm. A livable community should integrate land uses so that people can live closer or within walking distance of jobs, community activities, and services they need. And obviously transportation options that enable residents to get around even if they don't drive. Now, when I say transportation options, I want to make sure that people don't forget about folks who just walk. That is a transportation option, and it's the oldest one around, and I can tell you older adults love to walk. Besides driving, the second most popular mode of transportation is just walking. And what do they like to walk to? Bus stops. So please remember bus routes when you are discussing those issues at the VTA board. Buses are very popular among older adults. And so, you know, one of the things, and again, I wanted to go back to age-friendly land use planning, and I want to talk about housing in the context of age-friendliness. As Supervisor Cortese stated earlier, Santa Clara County is the first county in the United States where all cities have committed to becoming age-friendly, and that is no small feat. And so I love the fact that, you know, Diana Miller has been doing a ton of work to support those cities, and I want to recognize her for the great work she's doing. Now, the whole age-friendly network started in Europe with the World Health Organization, and so they've been doing research longer than we have. And so what they're starting to see is that in global cities, in global communities, like Silicon Valley, like Santa Clara County, housing has become such a problem that among the 8 domains, there is now, an argument among experts about whether or not housing should just become the center domain, should become the pivot domain, as they say. The most important domain, that focus is on housing. Because without housing, what they're starting to see, and as we see it here, without housing, many of the other domains just go away. And so what we're trying to do at the state level and at the local level is to push local jurisdictions to create land use plans that enable more and more housing to be built. Not just dense housing, all kinds of housing, whether they're large apartment complexes, duplexes, triplexes, fourplexes, whatever. It's about providing options. Thank you.
Thank you.
Thank you all so much.
So our last panel is PG&E outages and concerns, and this will be Gary Hersig, our Deputy County Exec, and Dana Reed, who's the Director of our Office of Emergency Services. And then we're going to come to you. So I want you to think very carefully about your 2 minutes, and I'm going to be really disciplined about, I want to make sure everybody gets a chance to speak, so I'm going to be a little bit bossy on that too. All right, welcome, gentlemen.
Good evening, Gary Hersig, Deputy County Executive. Along with me is Dana Reed, Director of Office of Emergency Management.
Good evening.
So in May of this year, the California Public Utilities Commission, as a result of the devastating wildfires the last few years, granted permission to PG&E and the other 2 power companies in California, granted them discretion to shut off the power during times of high fire danger. Since that time, we've engaged in a variety of activities to try to get the community prepared for such an event. Fortunately, so far since that decision was made, there's only been 2 public safety power shutdowns in California. One of those was earlier this year in Napa and Solano counties that affected about 1,500 customers. And then just last weekend, Southern Edison shut down power in Mono County for a few days due to high fire danger. So last word we had was that power was back on Monday. Again, so we started in May preparing for a possible power safety shutdown here in Santa Clara County. The first thing we did was bring this to our briefing to our op area council in May. This is chaired by Supervisor Wasserman. And then in June, we had PG&E come in and give an op area public safety power shutdown workshop, and we had over 120 individuals from about 70 different jurisdictions in the county and service providers at that workshop. A lot of good dialogue and questions about how this would take place. And then in June, we did briefings of all the Santa Clara County departments through our DPEC. We also met with the Santa Clara County Emergency Managers Association. And then just this last week, we presented to the Santa Clara City Managers Association along with PG&E. We've also done a lot of engagement, meetings with DAFN service providers in June. We developed a list of PG&E contact lists for public safety partners, service providers, critical facilities, and infrastructure. And then we identified potential customer resource center sites that throughout the county should one of these power shutdowns occur. And then our current focus is public information, getting the message out to the community to be prepared for one of these events, which could last up to 7 days, is what PG&E is reporting. And we started by engaging the South Bay public information officers. We distributed PG&E preparedness materials. We created a website. It's on the Office of Emergency Management website, a banner with all the information, how the public can be prepared for such an event. We've completed a PSPS annex to our Office of Emergency Management plans. We have those for earthquakes and fires and other things, but we created one for the public safety shutdown. We can identify DFN service providers, and we continued coordination with local government jurisdictions. Just this afternoon, I was speaking to the Assistant City Manager of San Jose about proposed messaging to the public for when a power shutdown occurs. So we're collaborating with all the cities, and we will continue to do that. We're keeping our fingers crossed that we don't have one of these events, but we want to be prepared if we do. So with that, I'll turn it over to Dana.
All right, thank you, Gary. How many folks in here have even heard about the safety power shutoff? Okay, that's good. That's encouraging. So I'm glad to hear that. You know, I think one of the challenges we're facing here, quite frankly, is there's a bit of an unknown. You imagine somebody calls you up or tells you, notifies you, said, you know what, I'm turning your power off. It's for your safety, but I'm going to turn your power off, and what the impacts of that might be. This is an unusual thing for us to even have to face. We're used to fires because we're familiar with those, earthquakes, floods, those types of things, but this is new. This is a brand new endeavor for us. So we've been working, as Gary indicated, we've been working very hard to plan for it, to prepare for it, and to get ready for it. We've done a tremendous amount of work over the last few months with all the jurisdictions within the county. We've had great support from the Board of Supervisors to get this done. But the challenges are still going to be, if we lose our power, we do have to be prepared for up to 7 days. That's a long time. We're hoping, and thus far we've seen some evidence that the power is coming back on with some of the Southern California Edison shutoffs, that the power is coming back on within 48 or less hours. But we don't know that that'll happen here. So the greatest thing that we need to do and continue to do is extensive public outreach, work with all our partners, many of which are actually here tonight making presentations, continue to work with all the jurisdictions, and continue to exercise, plan, and educate. But the most important thing you can do, everybody in this room that's here tonight, is you need to be prepared. Go to the website that Gary indicated at our Office of Emergency Management website. Prepare. All the information is there. And if you have not updated your contact information with PG&E, you really need to check that. And the reason I say that is you may have started your PG&E power account a long time ago, like me. But I don't know, I can't remember, you don't know what phone number you used. What number did you put in there? What was your contact information? You moved from, you moved from an apartment or to a condo, and then you get your first home, whatever the situation might be. So I really want to encourage everybody here, and that's an important thing to do, is to go into your PG&E website, your billing site, and check your contact information, because PG&E is obligated to do all the notifications initially and let us know if there's a PSPS event. We do have an action cycle up here that will be notified somewhere between 78 hours and 24 hours. We don't know for sure exactly how that'll happen. When we had the Napa Solano event, we tracked it very carefully. They had less than 24 hours notification. But the intent is to hopefully get at least 48 hours of notification. As soon as we're notified, we'll work with all the jurisdictional partners. We'll provide all the information through media, social media, on the radio, every place we can possibly touch. And then we will activate our EOC, the operational area EOC for the county, which will support all the jurisdictions within the county, and we'll start to address the issues that we need to address and support all the jurisdictions with any services that may be needed. I know folks have a lot of concerns about medications and things of those nature. There are plans in place for that. There are mechanisms to make sure if for some reason you don't have your medications with you because you had to leave your home or you're somewhere else away from your home, there are all types of ways for us to help assist to bridge that gap. But it will absolutely be a challenge for us. But I think it's a challenge that we're going to have to take on and work together to make sure that we can do the very best we can do during a power shutoff. But we're committed to do that. We're going to keep working on it. We're kind of in that season now for red flag warnings. September and October in this valley tend to be the two prime months for that to occur. You've got the Diablo Range on the east foothills. You've got the Santa Cruz Mountains on the west. Those are typically the two areas where the red flag weather may occur. So we're halfway through September, and we have not had that type of an event, but we are definitely, this time of the year is when we're at risk. We watch every single day the weather, what's going on. I get a state report every day that tells me of any potential PSPS events throughout the entire state of California, and we check that every single day. And so far, we haven't been listed on there, even as a potential, which is great, but you never know. So continue to be prepared and be sure to get, we left a lot of information on the back table today, and we have our kiosk outside that has preparedness materials in multiple languages for this event, PSPS. Thank you.
Please take it on the way out. So we have a lot of speakers, and I know you've been waiting, so I want to make sure everybody gets time to speak. What I'm going to do, Jim, is I'm going to have the public come, and you're welcome to sit up here, let them speak, and then we're going to have you join us in a wrap-up. So thank you for that. So what I'm going to do is I'm going to call you up in groups of 10. Normally, when we have this many speakers, we have a little over, I think we're almost at 25, and I did promise everybody we'd be leaving at 8:30. I'm going to indulge that I think we can do this by 8:45, and I like to do things on time because I want people to trust me when we ask them to come out. But what I'd like to do is ask if folks can limit your comments to 90 seconds, and if you can do that, then we can get everybody to get a chance to speak, and then if anybody here has questions or comments, we can get those. But also we can have a little work plan, which is really what I wanted to leave with tonight, with some next steps. And people gave us great actionable things. So if I can invite up Renee Paquier, to be followed by Debbie Vasquez, to be followed by Bob Gill, Christine Fitzgerald, Lori Anderson, Susan Frazier, and Christina Irving. And you can come up if I called your name, you can come up in any order, but I'd like you to make sure I've called your name before we do. Come forward. And you're going to speak at this podium right here, and the microphone's built in. It's kind of strange, but you'll get used to it. Welcome.
Thank you. Good evening, Assemblymember Calra, Supervisors Chavez and Cortese, and all of the esteemed members of the committee. As a dean at the first community college in the United States to be certified age-friendly, I speak on behalf of all of my colleagues at West Valley College when I say how much we truly appreciate the value of the RIDE program and the important role it plays in helping our seniors get around our county and to our campus. RIDE allows the clients of the program to be socially active and engaged, more independent, and stay connected with others by taking part in things such as attending non-credit classes, which are the free classes we offer at West Valley College, as well as take part in all of the free workshops that are available on our campus and off campus in Los Gatos, Campbell, Saratoga, and Monte Sereno. Lastly, I would like to invite all of our county seniors to sign up for the RIDE program and take part in the fun West Valley Striders program, which meets once a month to take a stroll around our beautiful campus. And when you do come by, please make sure to say hi to me. Thank you.
Thank you. Debbie, and if I can ask you just to come all the way up. Bob, come all the way up. We're just going to get you as close to that mic as we can. Welcome.
Welcome. Thank you. Good evening, Supervisor Cortese and Supervisor Chavez and the rest of you here this evening. Thank you for having this hearing this evening. My name is Debbie Vasquez. I'm the Older Adult Services Supervisor for the City of Morgan Hill. I'm here this evening to represent the older adults in South County. As you have heard, the population is rapidly aging, and it is critical that we work collaboratively across the county to address the issues facing our most vulnerable residents, the issues you heard this evening. As a result of Diana Miller's leadership, all cities in the county have earned the designation of being an age-friendly city, and again, we should celebrate that. And all cities are well poised to move this imperative work forward with the appropriate support and resources. On behalf of South County, our top priorities are affordable housing and transportation. Again, transportation is the lifeline for many of our seniors to the community. You have heard many reports this evening that require immediate action, heavy lifting, and support from the county. I truly believe that we are better together, and we have the ability to create the most vibrant, safe, affordable place for older adults to age in place and thrive. The foundation has been set. I look forward to seeing how we move forward collaboratively after tonight. Thank you for taking the time and making these issues a priority. Thank you.
Bob?
Thank you for today to setting this issue is very, very important for the senior. Today being here like from the state, city, and the county. So our message as Colorado take to the next step to the state. Because today, I thank everybody who's came in. That means this issue is important. The senior end of their life, they done whatever they're supposed to do. Today, they need help. And the housing. When housing is not there, it's worse than cancer. Because, you know, people live in bridges and everywhere, and they cannot have the right food, they cannot have the right medicine, and the mental health director is here. We have senior living all over in the bridges or all over. They have a mental issue, like saying, you know, devils in their upstairs or somewhere, and hurting the voices and all that. So we need more help on that area to get the more educated. I know you are doing the best you can, but we need more to more, because I never waste my time on negative. Because on positive, we all get together and make a difference. And housing, housing, housing. Homeless, we need to take care of. I do thank you for your
Bob.
effort.
And I'm going to ask Christina and Lori and Susan and Christina as you come forward. Oh, great. We have a mic for you.
Hi, I'm Christine Fitzgerald, Silicon Valley Independent Living Center. I'm here to talk about accessible housing. Accessible housing should also be universally designed so that anyone can age in place, whether it's a tiny home, whether it's new construction of any kind, condos, single-family homes, whatever. Flat entrances, zero elevation entrances, shower stalls that can be used for simply a chair or not, just making the area fully accessible for the individual. One of the things that I like to talk about is inventing and ensuring fully accessible transportation as well. So with that, I thank you.
Thank you, Christine. The mic's built right in there. I know it seems strange. You'll talk and you'll hear your voice. It's kind of cool.
Thank you. I'm Lori Anderson, and I'm the director of LTSS, and I'm glad I get to say LTSS, and you all know what that means now, at the Santa Clara Family Health Plan. And I think I might be the only one here tonight from a managed health care plan. We are one of the Medi-Cal managed plans in this county. We manage over 250,000 Medi-Cal members, and 33,000 of those are over the age of 65. This is a population that includes 25,000 dual eligibles, individuals who are eligible for both Medi-Cal and Medicare. So this is an older adult, poor population. Some of the things we do for that population now is we offer the CalMedi Connect program, which you might be familiar with, which is combines service. It combines Medicare and Medi-Cal benefits under one health plan. We do that under the Coordinated Care Initiative in this county. We're one of those CCI counties. We do provide a lot of case management for our members, and I haven't heard that said tonight, anything about case management. So one of the things I want to kind of put out there that hasn't been said is the need for coordinated case management. There are many case management programs in this county. They are in behavioral health, Office of Supportive Housing. We really need to do a better job of bringing these together and not siloing seniors for case management over here, but really looking at how to serve seniors in all of these case management programs. So I just want to emphasize that. Everything that's been said tonight, housing, 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 I will repeat that. I know that elder abuse has been raised around.
Thank you, Lori. I'm going to invite up Tim, Gail. I told you I'm going to be fair to everybody. Tim, Gail, and Marcia. Welcome.
Good evening, supervisors and others. I'm Susan Fraser. I'm with the Institute on Aging. For the past 4 years, we've been operating the Community Living Connection program and have successfully been able to address the needs of the very vulnerable LTSS population here in Santa Clara County. we've been able to reduce hospitalizations and prevent institutionalization. 2 years ago, we expanded our program as a partner in the Whole Person Care Pilot Program, and we are now operating the Nursing Home Transitions and Diversions Program under the umbrella of the Community Living Connection Program. Anywhere between 10 and 20% of individuals who are in nursing homes don't actually need to be there, but they're there because they lack support services and housing to be able to live in the community. In addition, at any given time, there are a number of individuals who are non-acute being housed in the hospital, which puts a huge burden on our taxpayers and the health and hospital system. IOA has taken on the innovative approach of resolving these problems by developing an integrated and coordinated partnership with Santa Clara Valley Health and Hospital System, DOS, Santa Clara Family Health Plan, and Valley Health Plan. Through these partnerships, IOA is able to provide and coordinate comprehensive care to transition individuals from skilled nursing facilities into licensed residential care facilities for the elderly. This is creating a new strategy for housing and supportive services.
Thank you. So Christina, Tim Dupick, Gail Osmer, Marcia Adler, welcome.
Thank you. Good evening. Christina Irving with Family Caregiver Alliance. We are a nonprofit serving family caregivers for over 40 years. In Santa Clara County, there are an estimated 250,000 family caregivers, and the care they provide is valued at around $3 billion. About half of these caregivers are providing complex care, often medical care, and they're doing so with very little training. As the cost of living increases, the access to resources and supports decreases, particularly for our middle-income caregivers. The state made an investment this year in the Caregiver Resource Center system, which provides for assessment, care planning, and training of family caregivers statewide, and will also allow for statewide data collection of family caregivers, as well as program evaluation. But caregivers are a vital part of our long-term care system, and the county is in a unique opportunity and a unique position to really support the integration of caregiver services into long-term care, so that caregiver assessment, access to services and resources is a part of our LTSS programs and resources. And when we better integrate caregiver services into our long-term care system, we see better outcomes both for caregivers as well as for the people that they're caring for. And while that's beneficial to them individually, it also has a huge financial impact on our system.
Thank you.
Hello, I'm Marcia Adler. I'm the coordinator of Age Friendly San Jose. With the seniors agenda, we've brought together leaders and practitioners to find solutions for isolation and loneliness among seniors. And today, with the mayor's office and with our friend from the state legislature, we celebrated Gen to Gen, a program that brings older adults and youth together for play and for learning. We've done this all under the age-friendly banner, and we believe that we're on the right track. In order to solve the problems of isolation and for more innovative and effective programs that bring communities together, we need the county to show leadership through increased funding for the seniors agenda and for grants, programs for innovation in serving the Santa Clara's 15 age-friendly cities. Thank you.
Thank you, Marcia. Ryan, Ryan Kawamoto, Amy I'm sorry, Amy. Thank you, Amy Andonia. Michelle Liu, Alex Morris, Laurel Perusa. Welcome.
Good evening, Supervisor Chavez, Supervisor Cortese, and Assemblymember Calra. My name is Ryan Kawamoto, and I'm excited to be here in my new role as Regional Director of Older Adults Technology Services, or OATS. First, I want to thank you all profusely for taking the leadership to hold this important meeting. OATS runs 6 Senior Planet sites around the country. I'm here on behalf of our Senior Planet site, run out of the beautifully renovated Avenidas facility located at downtown Palo Alto. Being a part of an organization that focuses on empowering older adults to use technology, I appreciate this meeting as we are proactively engaged with educating older adults to protect themselves online and use technology to actively engage with others through a multitude of programs ranging from classes to workshops. As we see an increase in both our older adult population and in technological advances, we are seeing an ever-increasing need for support and funding for older adult services, especially as it relates to technology. And so I thank you both, or all of you actually, in your support of our older adult population and for this meeting tonight. With 40 seconds left, can I pass that on to Amy?
No, sorry, we're not sharing, but Amy, welcome. And Amy's, I apologize. Good job, Ryan.
It was a good try. Good evening. My name is Amy Andonian. I'm the president and CEO of Avenidas, a nonprofit senior services agency based in Palo Alto. As we celebrate our 50th year of serving the community, Avenidas is growing its mission to be more inclusive and diverse. And to that end, we are expanding offerings to focus on LGBTQ seniors in Santa Clara County. This is the issue that I'd like to highlight this evening. While the U.S. Census has never measured how many LGBTQ seniors live in America, reports estimate that there are currently around 3 million LGBTQ adults over the age of 50. That number is expected to grow to approximately 7 million by 2030. These seniors face unique challenges as they age. They are twice as likely to be single and live alone, 4 times less likely to have children, far more than likely than their heterosexual peers to have faced discrimination, social stigma, and the effects of prejudice, and more likely, therefore, to face poverty and homelessness and to have poor physical and mental health. Avenidas seeks to increase its services to the LGBTQ community in Santa Clara County over the coming years. Next week, you will hear about an exciting new partnership that Avenidas is looking to embark on with Santa Clara County's Office of LGBTQ Affairs. We hope the Board of Supervisors will support this new partnership so that we can introduce new LGBTQ-focused best practices, models of care, and culturally competent services for older adults that can be replicated throughout the county and beyond. Thank you.
Thank you. Yeah, it's good timing.
Hi. Good evening. My name is Alexandra Morris, and I represent the Alzheimer's Association. In California, it's projected that 670,000 people have Alzheimer's today, and by 2025, a short 6 years from now, it is projected to increase to 840,000 people, representing a 25% increase in just 6 years. My comments tonight focus on early detection and accurate diagnosis. Early detection and accurate diagnosis can provide significant medical, emotional, and social benefits and facilitate participation in important clinical trials. Early diagnosis enables individuals to prepare legal, financial, and end-of-life plans while they're still cognitively able to make decisions and share their wishes. Also, they can take health measures to preserve their existing cognition, and safety issues can be addressed earlier. Additionally, it allows individuals and their families to participate in early-stage services such as education and support groups and focus on enjoying life. All of this can lead to significant cost savings in medical and long-term care for both the government and diagnosed individuals and their families. A major barrier is the thinking in the medical community and the community at large that nothing can be done, so why diagnose? And I hope just now that I shared with you all of the reasons why we should be pursuing early diagnosis. Thank you for the opportunity to share this information.
Thank you for being here. As Michelle comes forward, I'm going to invite up Ellen Rollins, Henry Linewu. Sorry, I'm sorry for that. Louis Rocha, Thomas Revelle. Thank you, Michelle.
Good evening. I'm Michelle Liu, and I'm joined by 3 very hardworking colleagues from the Health Trust. We are a nonprofit operating foundation focused on building health equity in Silicon Valley. To address food insecurity and social isolation among older adults in Santa Clara County, the Health Trust provides an array of food and nutrition services for vulnerable older adults. For example, we offer a daily Meals on Wheels program that incorporates an in-person wellness check in addition to healthy meals. We are also part of a statewide pilot called Food is Medicine Coalition, where we're expanding medically tailored meals programming. This is providing meals that are tailored to the medical needs of an individual, accompanied by visits by a registered dietitian nutritionist. We're excited about the preliminary results that we're seeing from the medically tailored meals pilot. We're seeing improved health outcomes, lower cost of care, and increased patient satisfaction. We look forward to building on our partnership with the county, and thank you again for holding this hearing.
Thank you, Michelle.
Good evening. My name is Laurel Perusa, and I thank you for giving me the opportunity to share my experience with the RIDE program. RIDE stands for Reach Your Destination Easily. I am a resident of Saratoga. I have been a RIDE client for almost 2 years. I have age-related macular degeneration, so I do not drive. I am an active volunteer in Saratoga. RIDE enables me to continue with my volunteer work. They pick me up from my meetings and my volunteer activities. It's very important for seniors to be engaged with their community and to be with their peers. I have a friend who is in her 90s. RIDE picks her up every Thursday morning and takes her to her art class. Our community involvement gives us a sense of well-being, we feel productive, and we feel that we have purpose. I encourage you to continue to support the RIDE program and the other senior transportation groups in the county, because this has wide-reaching benefits for all. Thank you.
Thank you. Welcome.
Thank you. Good evening, ladies and gentlemen, esteemed members of the supervisors. My name is Henry Linaway. I grew up in East San Jose. I've lived here 58 years, and I'm homeless. I sleep on the sidewalk in front of 92 South 5th Street. I've had 6 strokes. I've survived hepatitis C. I have a tumor in my neck. I need an operation. If I don't have it by November, I will lose my kidney functions and I will just die. Simple put, I'm not going to go through dialysis. I won't do that. I've been marginalized. The court victimized me. I had an agreement with my mother in perpetuity to stay in the residence. She knew I was a stroke victim. She knew I had hepatitis C. I beat the hepatitis C. And I have cirrhosis, the end of fibrosis, not because I was an alcoholic. I need help because I have 3 case managers, and I've been living at that address on the street for 10 weeks. I need some place to go after my operation so that I can recover. I'm physically able to do things. I don't want to live in, quote, isolation in the seniors center because somebody wants to get rid of me. Oh, you're not San Jose material because you're old. That's all I have to say.
Thank you.
So please help me.
Yep. Amy, can you talk to him? Thank you. Welcome.
Hello, my name is Thomas Ravel, and thank you all. And I'm a homeowner, and I've been in the county since 1982. And there have been some, I want to, maybe the issues are mobility and transportation. And there have been some improvements, but it seems that things have kind of turned around. I'm not seeing any evidence, recent evidence of age friendliness, and that I don't feel safe on the sidewalks at 4 o'clock in the afternoon. It's a lot safer at 4 o'clock in the morning, and this primarily the scooters and the bicycles and the tables and the chairs and obstructions and planters. There's even one business that has a bathtub on the sidewalk. So that's so this is also maybe an ADA issue. And then as far as the transportation, the VTA is doing their best, but even 20 years ago, you'll keep hearing that, oh, we need to raise the fares and cut services. Well, no, that's the wrong approach. You need to lower the fares, and increase the services. Otherwise, you'll lose ridership. And how do you pay for it? If you guys want to drive alone, you can buy me a bus ticket. So, oh, and then they're moving platforms, or moving the bus stops out in San Jose into the traffic lanes and building platforms. There's one platform under construction for 4 months. And then they've taken out, as I said, removing bus stops, one thing. Yeah, okay.
Thank you, Thomas. So Ellen, Louie, and Ellen, as you come forward, may I call up Leah Cowan, Cynthia Rovangay, sorry, Richard Adler, and Tom Pickra. Thank you. Welcome.
Good evening, Assembly members, supervisors, members of the panel. My name's Ellen Rollins. I want to speak on long-term services and housing as a connected piece. I'm 76 for a few more months, and I'm still working full-time. Terry and I are hooked at the hips. Terry is a quadriplegic. My daughter, now 20, she's 54. And we live in, I want to narrow, because I agree with everything that's been said before, but I want to focus on the housing that you do have, such as in specifically Mid-Penn, and how that it appears to us that those of us who are quads, who are seniors, are being repurposed out of that property, which was specifically Viviante 1 for spinal cord injured individuals when it opened in 1990. Terry's been there since 1990, and she fears eviction every month for this reason or that reason. Lots of other issues. We're working on them, but they're not, they're sort of under the cover, and this is something you already have. So make sure they are working appropriately so that those quads that are there aren't homeless next. Thank you.
Thank you.
Good evening, supervisors and panelists. My name is Louis Rocha, and I'm a lifelong resident of Santa Clara County and now part of the esteemed group of seniors. And tonight I want to bring to your attention an issue that's impacting the Latino community heavily. While we agree with all the goals of the items in tonight's hearing, there's also a need that needs to be addressed, and that's of seniors having to care for children and other family members. It's impacting our community even more so because of the high dropout rate for Latino students, still 25%. It's outrageous. The incarceration rate for youth in the juvenile justice system is double of what our population is. And we need some support services for seniors to help raise our children, our grandchildren. I have 2 adopted children, family members that my wife and I are blessed to have. We are taking that on, but there's many others in our community that are having challenges with the school system, with social services, with getting the wraparound services the children need to have to get through all their issues. And so I want you to expand your focus and include those areas, those pockets, sizable pockets in our community that need attention, like support for seniors that are raising their grandchildren and other family members. Thank you.
Thank you.
Hi there, Supervisor Chavez, Supervisor Cortese, and Assemblymember Calra, and the rest of the committee. My name is Leah Cowan, and I am a new hire for Sutter Health, a government relations professional. I'm part of an effort to be better aligned with the community, and I'm here mostly to listen. Some of the issues that were brought up and to be a liaison and report back and make sure that our community benefits and our services are better aligned, particularly in this demographic. But I also wanted to relay some of the things that we're doing well and a resource that I believe a lot of the stakeholders here should know about if anyone should need it or
we should highlight their services at this particular center. And Palo Alto Medical Foundation, we are proud to have invested in community health resource centers at our locations. These resource centers are free. They're staffed by a nurse or a master's in public health professional to help our patients or non-patients navigate through a new diagnosis or a diagnosis for a family member, to find services like Avenidas and RIDE, to also just better understand, what to do next. And the great part of this resource center is that it's free and available to everyone.
So if I could invite up, we have Cynthia, Richard, Tom, Mr. Eberhard, Wes Mukiyama, and Eugene Bradley. Welcome.
Good evening. Thank you for this opportunity to speak with you this evening, our supervisors, our elected officials, our community leaders, my sisters and brothers. Who am I? I am Cynthia Ronicky. I have been a primary caregiver to my parents before their demise for greater than 10 years. I find myself in a situation where I could navigate the system and navigate it pretty well, very adequately, tapping into some of the services provided here and also in other states that we had resided in during the time frame that my parents moved with me. I have known how to deal with medical complexity and complex issues for seniors. I was blessed in being able to give a home to my parents, to wipe away their tears at nighttime, to help them fold their hands in prayer, saying, thank God. And I received so many beautiful blessings from them. What would we do if we didn't have you? We didn't want to leave you with this burden. We're in poor health. We cry because we have placed a burden on you. No, not at all. Thankfully, because of their love and my ability to commit to them, I serve on 2 boards, Heart of the Valley and Santa Clara Methodist Foundation. Both of these retirement foundations serve greater than, in combination, 700 individuals, serving our seniors from multiple needs for independent living.
Thank you, Cynthia. Welcome.
Hi, good evening. I'm Richard Adler. I'm the chair of Age Friendly Cupertino, and I'm a brand new member of the Senior Commission, thanks to Supervisor Cortese. Thank you for appointing me. I want to make 2 quick points. First of all, we have heard about lots of problems. They're real, they're urgent, and they're difficult. Abuse, health, food insecurity, isolation, mobility, housing. They're all real, they're all important. But let's not just look at aging through the lens of problems. It is also an enormous opportunity. Older people are one of the society's few increasing resources, and they have a tremendous amount of experience to offer. And as you look at those problems, don't just think of it as us helping them. Think of us as working together to make our society better. And every older person has something to offer. And I want to end up, though, mentioning one other problem, which I had not heard talked about tonight, and that is ageism. I think that's a deep, pervasive issue that underlies a lot of the others. It's a kind of a tacit assumption that people lose value as they age. They lose capacity to be useful to society. And it's been described as the last socially acceptable prejudice. So just keep in mind that we need to deal with that issue.
Thank you.
Good evening. I'm Tom Picro. I'm a member of the Los Gatos Service Providers, co-organizer of that, and also of the Advisory Council for our county's Area Agency on Aging, called SourceWise. I want to just reemphasize 4 points. One is in the area of food security. It's really growing in our area, in our community, for example. It's a real issue. What the county is doing is critically important. And also, don't forget about food banks. You get tremendous local volunteer support from these, and encouragement and support of those areas is important. Second is the area of adult daycare and caregiver support. As you heard from our Alzheimer's Association representative, this is an area of tremendous high growth area, unfortunately, and it's one where there's a growing needs. And it's very important to support that through the county, as well as supporting great organizations like the Alzheimer's Association to work on that. The third area is transportation. RIDE is very important in our area of the southwest part of the county, and you've heard about that. And the fourth area is the LGBT older adults' needs. And to that point, SourceWise has just added to our advisory council position, representative position for LGBT, and we're pleased to do that.
Thank you. So, Don, are you going to speak again? Okay, so my last three speakers are Wes, Eugene, and Don.
You guys can get a little bit out of order. Evening, supervisors. My name is Eugene Bradley. I'm the founder of the Silicon Valley Transit Users, a public transit advocacy and watchdog group. I encourage everybody, and especially every senior, to help to join my group. Help in the fight to get VTA better. I couldn't help but listen to all the presentations regarding the isolation, mobility, and other issues, and some of that stems from the fact that some of the supervisors have voted to cut VTA's bus and light rail service, as well as raise fares over the last 20 years. One solution which our group and some of my colleagues have worked on in my absence, one solution to that, reallocate highway funding from Measure B and use that to increase the bus and light rail service, which is desperately needed. After all, we've never seen one report on any highway that's ever actually relieved the gridlock that we all complain about, meaning it doesn't even work. So it's time to change that. As for housing, that's desperately needed. And I was also asked the citizens to stop blocking any housing proposals. The next person that could need that housing one day could be someone like you, if you think about it. Finally, let's just do better for the seniors. We just highlighted some examples, so let's start doing it right now. Thank you.
Hi, I'm Don Eberhard again. With regard to seniors, they're not easily able to navigate the complex bureaucracy of government agencies, handle financial matters, and also make tough choices and try to make sense out of the insurance, healthcare coverages from Medicare or whatever. So I think there's a lot that can be done through Sutter Health and other organizations to help that. Another hot button is relative to adult protective services, specifically in the area of behavioral health. If you need to do like an intervention or something for someone that is a danger to themselves, I actually got involved with APS with someone, and what happens is they're entered into emergency, and then they're basically shuttled out to a 72-hour hold, and then they're basically released. And many times they can't be released back to the home or anywhere, so there's a big hole there. And last, relative to volunteerism, the best thing we can all do for seniors is to not tweet them and text them, but actually get physically involved with them. I have had parents in nursing homes or whatever, and I played a piano at nursing homes and in hospitals. There's a movie out called Alive Inside that talks about Alzheimer's patients and the power of music to bringing people alive. So I encourage people to physically get involved with people on a personal level. Thank you.
Thank you very much. Wes?
Hi, my name is Wes Mokoyama. I'm a former Peace Corps volunteer and Red Cross mental health volunteer who serves on 5 older adult committees: behavioral health, hospital to home, whole person care, aging services collaborative, and SourceWise. I followed a homeless woman, advocated for her since 2018 June. She still doesn't have a permanent housing. She still lives in the shelter. And I followed a 91-year-old man in the jail who died who died a week ago in jail. 2010, I chaired the Older Adult Summit Committee through Mental Health. We found out were too many silos or turfs which do not talk to each other. It is the culture of this Santa Clara County community. And what we need is an oversight committee with clout, combining county and city officials with clout again, and also considering blended funding as they have it in San Mateo County. And we need a Santa Clara County-wide navigation system for older adults with one phone number and warm handoffs, and focusing on minority seniors who outnumber, or people of color in this community who outnumber the mainstream.
Thank you, Wes. So, Jim, I'm going to give you a couple minutes to give your thoughts, and then what I'm going to do is see if there are any questions from the panel, and then we're going to make some next steps, and we're going to try to do all of that in 7 minutes. All right.
Absolutely. Good evening. I will be brief. My name is Jim Ramoni. I'm the Director of the Department of Aging and Adult Services with the County Social Services Agency. Supervisor Chavez, Supervisor Cortese, and members of the panel, thank you for convening this evening's hearing to highlight key issues facing our community's older adults. This is a positive step in rethinking existing systems, as well as creating policies and programs to address the major demographic shifts in our society. Although we routinely focus on the enormous unmet needs and gaps in services, adopting an age-friendly perspective emphasizes the positive contributions of older adults to our community, both economically as well as sharing their collective wisdom and life experience to other generations. Just as in the 1950s, when government responded to the baby boom after World War II by building new schools and training more teachers, we now have a similar situation with the baby boomers facing the challenges and opportunities of retirement and elderhood. All levels of government must make the shift like they did in the 1950s. Be mindful that this is not a temporary phenomenon, as once the last baby boomer dies, the millennial generation will be turning 65, and they are an even larger demographic than we are. For the past several years, the county has offered perspective and led efforts on racial and health equity by integrating this work through a systematic lens. Age-friendly work should be embraced similarly. Practically speaking, all forthcoming policies, budgets, and programs should be generated with age-friendly principles as a foundation. We recommend that key departments participate in an age-friendly assessment created by the Denver Regional Council of Governments, and I am offering our department resources to help in this endeavor for county departments. Enhanced communication was identified as a major community need as a result of our recent age-friendly survey and assessment. Public awareness requires dedicated resources for marketing of the vital programs and services that are available. We recommend that dedicated funding be allocated for public awareness campaigns, marketing, and outreach for programs benefiting older adults. This should include innovative methods of communication, such as social media, as well as traditional formats that our elders look to, primarily print media. The focus of our August Senior Agendas Network Summit was the lesbian, gay, bisexual, transgender older adult. An outcome of the summit was newly created partnerships with the Office of LGBTQ Affairs and the Senior Care Commission to create more support for LGBT older adults in our community. Beginning in 2018, California has mandated the collection of sexual orientation and gender identity data in senior programs. However, there is still urgency to collect local data for vulnerable and historically underserved subpopulations. Towards this effort, the Department of Aging and Adult Services, the Senior Care Commission, and the Office of LGBTQ Affairs will be leading an effort to launch an LGBTQ Senior and Aging Adults Needs Assessment. To facilitate a successful data collection, we will need all county departments and elder-serving community organizations to participate in the promotion of the study and survey delivery in some way. This needs to be a community effort to yield wide community learning. Of special importance are community advisor leaders who can share the information in ethnic and linguistically diverse communities. We are looking for voices and experiences to be included. Thank you for this opportunity.
Thank you, Jim. You're not kidding. You wrapped that up.
Yeah.
So are there any comments or questions? I'm going to go around, and you don't feel obligated. I'm not staring at anybody in particular. But if anybody over here wants to give any feedback? No? I'm going to go to this side. Anybody here on this side?
I have a few things to say. Thank you for your final comments and words. I thought it was very comprehensive view and vision of what we could be doing moving forward. I just had a couple of questions that that don't need to be answered, but I'm just hoping that we include them in our work moving forward. I heard a lot about transportation, a little bit about walkability, and I just really question what more can we be thinking about of walkability and for seniors to really help the livelihood of seniors' lives, to avoid accidents, traffic-related injuries, and really to help mitigate the onset or management of chronic conditions. I really like that idea, and I would love to hear a little bit more. The other thing that I questioned on one of the presentations was the high cost of support services, particularly caregiver support services. There was a huge amount, and I know that there's a huge disparity in what people pay for caregiver support and what the caregivers are actually paid, and there is wide diversity of difference there, and I question that because I think it's a very important piece of senior services and something that's not very affordable for many people. And then I also wanted to talk just a little bit about I love the Grand Friends, by the way. That was really a lovely idea. I want to talk a little bit about Alzheimer's, and because Alzheimer's really makes all of the things that were discussed today are more difficult when one has Alzheimer's. And I want to underscore and acknowledge your words around racial disparities and how can we get the voice of all ethnicities involved in this conversation, because as we get older, we become our historical selves. So issues related to mistrust and fear become more magnified for ethnic populations as we get older. And so I'm happy to hear that you want to engage in a dialogue. And the person before you, I also wanted to acknowledge that someone said engaging seniors is part of the solution. So I'm really interested in the how and how that can happen and how can we do more of that.
Did you want to speak also? Anybody else? The only thing I'm going to ask is that people be clear and brief, and only, because we can get more information, and if you have ideas about next steps. So welcome.
I have lots of ideas, but I want to say thank you to everyone here, and I want to emphasize the specific needs of seniors with mental health, with drug issues, with high suicide rates. And in our department, we're really focused on trying to address those needs, but that's not something that's been discussed. So I just want to put that out there as part of our discussion going forward. Thank you all. Excellent, excellent presentations.
Thank you for that, Tony.
Thank you, Supervisor. I'm going to put a clock here. There's so much information, but I just want to thank everyone that presented. And just in regards to a couple of the items that were mentioned, the elder abuse, I was able to get $15 million last year to the budget to bolster APS, Adult Protective Services. But this year, you may not be aware, there's $5.8 million for statewide training over the next 3 years. Let's go after that money for better training. We do have a bill that was approved this year for a no wrong door system for accessing senior services. So it's in line with what this county is already working on. On LTSS, although I had a bill to expand assisted living waiver program, that didn't get through, but we did get money for data collection on LTSS, so we can better track the data statewide on LTSS services. The last couple of things is on housing and housing production. I think great comments on that. Housing is healthcare. This county gets it. I think we're trying to really push that mentality at the state level, and including with proper land use planning, because we need to make sure that our cities are doing everything they can, especially with our high rate of senior homeless. And the last thing I'll mention is on the public safety shutdowns. Senator Scott Wiener and myself have really raised the alarm on that issue. I think it's very scary to give unilateral power to an investor-owned utility to make those decisions. So I think it's really important that we organize well with our county, with our cities, to make sure that we're doing our part, because we have lost some of the control. And so there's got to be accountability as well as trust built with utilities that really haven't earned it. We have to make sure that we do our part to ensure that our community is getting that knowledge. So thank you all I just want to give those quick tidbits, but thank you.
Chair Chavez, if I may, on this side.
So again, thank you to everyone as well. I wanted to underscore some of the comments of Director McClinton Brown brought up in terms of the data collection that's needed to really understand what are the linguistic needs of the aging community, what are the culturally relevant programming that we need to really look at, and also the information delivery. I think a lot of the questions were about outreach and early awareness, but how is that information getting out there, and how is it best out there for the community? I know that as we move forward, it's not an overreach to say that on behalf of the Division of Equity and Social Justice, a big part of our work is that community engagement and outreach. And so as we embark in the strategic planning, and Mike's here, who's leading that effort, Mike Gonzalez with the Division of Equity and Social Justice, that we definitely want to be looking at the issues, equity issues for seniors and aging adults through an LGBTQ, immigrant, cultural competency, labor enforcement, women policy lens. And so that intersectionality of all these identities with age is super important in moving forward.
So I'm going to do some just wrap up. First of all, I want to say to all of you who stayed this long, thank you. I really appreciate it. I'm not kidding. These are very complicated issues. We had I think 12 experts, 12, 13 experts. We had 30 pieces of testimony, and I just want to thank all of you very much for being here. And we got deep into some issues. So let me just talk about next steps. Supervisor Cortese and I are very interested in getting the panel presentations and anybody who spoke here who can put their issues on one page, not tiny print, because these are those kind of glasses that I need to be able to look at both, but on one page that are actionable. Some of you did that in your presentations, and I absolutely understand what to do. We've got a task force that will look at elder abuse in a more aggressive way. I mean, there's some of them that I could really chunk off and act on that we can. Here's what we would like to recommend on behalf of Supervisor Cortese and I. If people can give us their most actionable items, we will take a Children's Family Seniors Committee, blend the overarching body of work that Jim just outlined, and prioritize areas where we think we can bring recommendations to the Board of Supervisors. And get them approved. Yeah, that's kind of important. We'll need your help. Okay, so we bring them to our colleagues, and we're going to need your help to do that. So what we'd like to request is that in the next 2 weeks, and if you, I'm trying to think about, most of you know how to get us, but if you can get to Amy. Did you guys sign in tonight? Did we not have you sign in? Okay. What we're going to do, what are we going to do about that? Well, what we're going to recommend is it's really easy to Google either one of us and get onto our website, and you all know Diana Miller, right? Diana? So either get to Dave or I or Diana, and we will coordinate to put together an hour workshop before the end of the year to prioritize these, to ask for your feedback on what we bring forward as part of an action, and we'll work with social services and the county exec's office to do that. We'll do a meeting as part of our Children's Family Seniors Committee. We'll let you know when that is, and we'll try to do some prioritization. It's really important for us. Part of the reason we do these hearings is we really do want to get action items out of them. Part of the reason we have the cross-section of leaders that we have on the board is we know it's going to take all of these departments to help us actualize this. We're going to shoot for before the end of the year to get something to our colleagues, and we'll work more closely with our team to do that. So we all know how to get a hold of Diana. Amy, if you want to talk to Amy and get something to her. For anybody who was on our panel, we know how to communicate with you, but we are going to probably do a couple of interviews with some of you just to help us frame up the approach we want to take. Does that sound okay to everybody as a next step?
Supervisor Chavez, and I think we could commit to this if you're willing to do it, and only one of us can do it. I'm pretty sure council will tell me, but I think the clerk and IT could probably help you get up on your website.
A button.
A button, thank you. A button where people can click right in and put their condensed recommendations in the next couple of days. So
Yeah.
easy to find your website, and if people can just remember to do that in the next couple of days, I think that would be good.
No, these
They
tech
don't need to
person
come
up
to
here,
me,
so
just to
button.
you. since we're a,
Oh, right.
we're a Brown Act body, but
I
they
forgot
can come-
about
They can
that,
come to you and you
violating
can put them
rules.
together
Okay.
in the next agenda, if that makes sense.
It does, and I will say, first Diana, that might even be better, and then second us, but we'll figure out how to accept that, but you really can just email me. So, and I forgot that I can't strategize with Dave before we come to our next meeting, because it's a violation of the Brown Act, which if any of you want to know that painful story, I'm happy to talk to you about that after the meeting, or our attorney will. The last two things I wanted to say is a very, very deep appreciation. Every one of the presenters did such a good job giving us the highlights. That was excellent, and we just wanted to say thank you to you for that. To all of the speakers, your comments were very thoughtful and very thought-provoking, and I didn't mean to be looking down, but I was taking notes on new ideas that you were giving us. And I wanted to just say a very special thank you to Amy, to Jim, and to Diana, who we just adore. You guys did a great job. And also to Frank, who is going to have all of our notes. They're going to be perfect, right? No pressure. All right. Well, thank you, everyone. And we are adjourned. And I deeply appreciate it. Thank you, everyone. Afterwards, we can talk. Come on over.